crucial turning point in Japan's social and economic journey. The government has taken a major step towards strengthening the foundation of healthcare and caregiving, the sectors that quietly support millions of lives every single day. This new move is not just a policy decision, it's a promise to every nurse, every caregiver, and every patient who depends on the compassion and skill of these dedicated professionals. Across the nation, hospitals and nursing facilities are facing immense pressure. Rising food prices, surging fuel costs, and increasing outsourcing expenses have become a daily struggle for institutions that were already stretched thin by years of financial strain. Recognizing this urgent reality, the government has decided to include a powerful package of subsidies in the 2025 fiscal year supplementary budget. This package aims to support wage increases for medical and caregiving staff while easing the financial burden of soaring operating costs. The intent is clear: to ensure that Japan's healthcare and welfare systems remain strong, sustainable, and resilient in the face of global economic challenges. Prime Minister Sanae Takaichi has made it clear that this initiative forms a central pillar of her comprehensive economic policy. It represents a vision of fairness, stability, and gratitude toward those who devote their lives to caring for others. Under this plan, hospitals and nursing homes will receive targeted financial assistance. These funds will help cover essential needs such as nutritious meals for patients, fuel for transportation and heating, and the growing costs of contracted services. The move will also encourage innovation and efficiency. Facilities will be urged to adopt digital tools and modern management systems that reduce paperwork, cut waste, and allow staff to focus more on direct care rather than administrative burdens. Japan's population continues to age rapidly, and the need for reliable medical and caregiving support grows stronger each year. The government's strategy acknowledges that stability in these fields is essential not only for the elderly but for society as a whole. This policy sends a strong message to healthcare workers that their dedication will no longer be overlooked. That their hard work, especially during difficult times, deserves recognition not only in words but in tangible financial support. The supplementary budget will also seek to balance short-term relief with long-term reform. The aim is not simply to patch the problems of today but to build a system that can endure for decades to come. Medical institutions across rural areas, where staffing shortages are severe, will particularly benefit from this new measure. The government understands that equal access to healthcare must be preserved everywhere, from major cities to remote islands. In addition to direct subsidies, the administration plans to promote interfacility cooperation. By sharing resources and coordinating regional medical networks, the goal is to create a more efficient and community-based care model. The challenges are immense. Inflation has made daily operations increasingly expensive, while global supply chain disruptions continue to drive up the cost of essentials. Yet, through strategic support, Japan seeks to overcome these barriers. For patients, this means continued access to quality care. For healthcare providers, it means security and motivation. For the nation, it means stability and compassion embedded in policy. The supplementary budget will likely include allocations not just for healthcare and caregiving, but also for digital transformation in administrative processes. Streamlined systems will reduce staff fatigue and prevent burnout. Efficiency will be paired with empathy. The government's approach focuses not only on numbers but on the human stories behind them: the tired nurse, the dedicated caregiver, the worried family, the grateful patient. This initiative will ensure that caregiving remains a respected and sustainable profession. Young people entering the field will find it more rewarding and financially viable, helping to address the chronic labor shortages that have plagued these sectors. Training programs will also be enhanced. With proper funding, institutions can provide better education, improve safety standards, and foster teamwork among staff members. Every yen invested in this policy is an investment in Japan's social heart. Healthcare and caregiving are not costs to be reduced, they are lifelines to be strengthened. Prime Minister Takaichi's leadership in driving this policy reflects her broader goal of building a resilient Japan, one that protects both its economy and its humanity. In the coming months, debates in the National Diet will shape the final form of the budget. Yet the direction is already set: to support those who have supported the nation through crises, pandemics, and daily struggles. This supplementary budget proposal will become a symbol of post-crisis recovery and social solidarity. It demonstrates that Japan values care work as a cornerstone of national strength. At its core, the plan reflects a simple truth: without healthy people, there is no healthy economy. Without caregivers, there is no community. The government aims to finalize and pass the proposal within the current parliamentary session, ensuring swift implementation before economic pressures worsen. Stakeholders in the medical and welfare sectors have welcomed the decision. Many institutions see it as a lifeline that could prevent closures and maintain stable service delivery. The program will also emphasize transparency and accountability. Every facility receiving aid will be encouraged to publicly share how the funds are used to improve worker conditions and patient care. Local governments will play a key role in distributing and monitoring the funds, ensuring that support reaches even the smallest and most vulnerable institutions. Japan's healthcare system has long been admired for its accessibility and quality. Maintaining that reputation requires continuous adaptation and support, especially in times of global inflation. By integrating financial aid with operational reform, the government seeks to modernize the sector from the ground up, creating systems that are both compassionate and cost-effective. This initiative may also inspire broader discussions on social welfare funding and the role of public institutions in safeguarding human dignity. From large hospitals in Tokyo to small clinics in countryside towns, the effects of this policy will ripple across every corner of the nation. Caregivers, who often endure long hours and emotional exhaustion, will gain renewed hope knowing that their efforts are valued and rewarded. The message to the nation is powerful. Japan will not allow its caregivers to struggle in silence. It will stand with them, support them, and ensure their stability. This policy also sets an example for the world. In an era when many nations face aging populations, Japan's approach could become a model for balancing compassion with fiscal responsibility. It's not only about raising wages, it's about restoring pride and purpose to those who keep the heartbeat of society alive. The 2025 supplementary budget will therefore stand as a testament to the government's vision, a Japan that protects its people, uplifts its workers, and prepares for a future built on care, stability, and solidarity. Every hospital corridor, every nursing home hallway, will echo this renewed sense of commitment. This is a new chapter, one where empathy meets policy, and where gratitude becomes action. Together, Japan steps forward, toward a society that cherishes those who care, values every life, and builds strength through compassion. This is not just a fiscal decision. It's a moral one. And it's a promise that no one who heals, supports, or cares will be left behind.